my name is Narda Alejandra Nieto Guerrero, and I'm going to talk about the resection of the inferior cervical ganglion. This is a surgical procedure, a surgical intervention. But first, I want to talk about what a ganglion is. A ganglion is part of the peripheral nervous system. A ganglion is literally a cumulus of neurons, which are the principal cells of the nervous system. And we have lots of ganglions in our body. We have one huge group called the sympathetic ganglions. We have lots of sympathetic ganglions, and we have subgroups for these ganglions. We have the cervical group, we have thoracic ganglions, we have abdominal ganglions, and pelvic ganglions. In the case of the cervical ganglions, we have three. We have the superior ganglion, we have the medium cervical ganglion, and the inferior cervical ganglion. In 80% of the population, this inferior cervical ganglion is joined with the first thoracic ganglion, and this forms a huge ganglion called cervical thoracic ganglion or stellar ganglion. In this procedure, you literally resect this ganglion to stop the sympathetic information. Sympathetic information allows us to sweat and to have vasoconstriction. So, for example, this procedure is indicated for people who have lots of vasoconstriction or sweating in the region of the head or the superior part of the nervous system. So, if you resect this ganglion, you won't have sympathetic information going to your head and the superior part of your nervous system, including the brain. So, you won't have sweating in the head, you won't have sweating in your face, and also you won't have vasoconstriction, including the basals of the face, basals of the head in general, and basals of the brain. And I learned this procedure in my anatomy classes the last semester, and that's all. Thanks for watching.